Consider the following. Does health promotion and primary prevention really take place in the doctor's office? Or does it happen where the people live, learn, work, worship, and play? Similarly, when it comes to making the most of electronic health records, which can't deliver on their promise if patients don't comply, our coalition has spent considerable time determining the most effective way to augment and complete what the experts have overlooked. And it's in this way that we will help the health IT revolution achieve its most important goals. Would you like to hear more, or better yet, get involved? If so, please visit healthreformcoalition.org and be a part of the answer that will have a beneficial impact on society for the good of us all. Topics that our stakeholder community have focused on include ways to stem inappropriate use of the emergency room, which is the fastest way to reduce costs to hospitals and thus preserve our public health safety net. Ways to improve access to quality care in urban and rural areas despite the shortage of health workers and facilities in communities where they're needed most. Partnerships to help wounded soldiers and their families make a smoother transition to a productive civilian life, including solutions that help caregivers cope with the increasing demands when they're seeking relief too. And how about this? An effective approach to addressing the burden that the impending H1N1 pandemic will place on an already overwhelmed public health safety net. You might recall that the emergency room was flooded not by people who actually had the flu, but by people who had no symptoms at all and were simply scared. Clearly, there's a need for what we have to offer, and it's our hopes that the leaders of the health reform movement will engage us and benefit from the progress we've already made. Why recreate the wheel? If you represent nonprofit organizations who are committed to serving the greater good, we invite you to join our coalition, share in this story, and help us raise funds and attract grants to deliver a grassroots solution that augments and completes and meets top-down strategies that are being enacted on Capitol Hill. That's what the Health Reform Coalition is all about, uncovering unmet human needs and adding value where it makes sense, given our expertise, that we might be a beneficial impact on society. Now here's something to consider as it relates to the goals of a hotly contested healthcare debate. What good will universal coverage really deliver if there are not enough health workers or primary care facilities to meet the rising demand? Fortunately, the Health Reform Coalition has invested considerable attention in a solution that will improve our nation's response to a resource shortage that up till now no one has addressed in an effective manner. Our experts have key suggestions and a core methodology that will make a positive difference where it's needed most, probably in a community near you. All it takes is for your local leadership team to reach out to us and find out how. In times of change, it's the learners who inherit the earth, and it's the enablers who guide and support them that will help them thrive. Isn't this what a successful economic recovery is all about? If I'm right, innovative health reform solutions will do more than just generate modest savings. It will create jobs to support health IT, expanded access, and provide more health workers to assist in getting people out of the institution and back into the community where they want to be. Remember, empowered patients heal faster and better for less and for good. This is an opportunity to become the change that we wish to see in the world and lead by example. Are you ready for some good news regarding health reform? If so, join with us and make a positive difference where it's needed most in a community near you. Please visit healthreformcoalition.org to register your thoughts, support our cause, or get involved. If not now, when? If not you, who? So now you know who we are, how we think, what we want to do, and where we're headed next. All that's missing is you, and potential introductions to stakeholders in your community who you think might benefit from all the legwork we've already done. Please visit healthreformcoalition.org to learn how your community can get involved in a health reform solution whose time has come that will benefit us all. I look forward to making a difference in the lives of many with you and to providing innovative health reform solutions that will truly serve the greater good. Now this is change we can believe in. God bless and all the very best. And I'll see you at the top.